you for tuning in to Dear Mama podcast, part of Airway Circle's radio station. This is episode 6, and I am your host, Dr. Catherine Murphy. Today, my guest is Dr. Jasmine Elmore. So let's set the stage with the following quote. Use your skills, your knowledge, your instincts to serve, to go change the world in the way that only you can. That's by Robert F. Smith. And I chose this quote because our guest truly is changing her field of pediatric dentistry using her many talents and her vast knowledge, which I'm going to share with you because her bio is incredible. Dr. Jasmine Elmore is a board-certified pediatric dentist, a certified specialist in orofacial myology, and is one of the few people in the world to have a professional degree in the science of breathing behavior. Her personal pain journey led her into airway dentistry. She has been fortunate to be trained by many of the legends in this field. She has studied in Australia and Canada, in addition to multiple states here in the US, to understand how the entire body connects for ideal outcomes. Her airway fairy godfather is Dr. Barry Raphael, who personally trained her in his office after she completed her Airway Mini-Residency. She is the first dual mini-resident proctored by both Dr. Soroush Zaghi and Dr. Chelsea Pinto at the Breathe Institute. Dr. Elmore has taken courses from physical therapists, osteopaths, lactation consultants, speech-language pathologists, and other essential providers to learn more about the whole patient to provide an elite level of care. Combining her studies with pediatric dentistry, airway health, and restricted oral tissues and behavioral breathing has helped her holistically heal both children and adults alike. So who else is so excited for this upcoming conversation with Dr. Elmore? Dr. Elmore, thank you so much for taking time out of your day to talk with us. Welcome.
Thank you for having me. I am not in my office right now, but if I was, you would see your Dear Mama book right there, front and center on my book wall.
Aww.
So I'm so excited to finally spend longer than like a quick little Instagram chat with you because you are amazing and I love your book so much. So nice to meet you.
Oh, well, thank you. And for our audience, I was just talking with Jasmine before this and it's like, oh my gosh, I feel so close to her already. And this is our first time of actually being able to talk over Zoom. So you are in for a treat because I just have a million questions for her. And like, I want to like reach in and grab her out and put her right here in my office.
We can make that happen.
Let's make that happen. Actually, I'm hoping to see you in September. Are you going to be at the Collaboration Cures?
Fingers crossed I will be there. I've added a couple of new opportunities this year on my docket, including going to Australia in 4 weeks. So we'll just see how tired and jet lagged I am. But no, I definitely plan to be there.
Well, you know, I have a holistic questions. And if you've listened to this podcast before, sometimes you'll hear me say, oh my gosh, we didn't even get to the first question. And so I'm going to go off charts again because I hold Australia. It has a special place in my heart. So can you just start by letting us know what you're going to be doing in Australia?
Yes. So back in 2019, Dr. Barry in his New Jersey office hosted a doctor from Australia, Dr. Joe DeCruz, and he has this appliance called the Soma Appliance, the splint orthodontic or orthopedic, depending on which country you're from, myofunctional orthotic, and it's an orthotic that's based on principles of unlocking our neck and letting our body holistically heal itself. So it's based on studies that he did with cranial doctors and physicians, and he's been using this product for 40 years. And the first time I laid my eyes on it and sat in that lecture, it was like, I need to learn more about this. So behind the scenes for about 2 years, I've been intimately studying with him exclusively in this appliance. And I have one that was created for me, and he's going to adjust it for me there. And then I'll work with some of his patients. Australia, the way Australia's HIPAA rules work, because I've gone before with MyoBrace and got a chance to actually like get my hands on some of the patients. Well, the laws there will allow me to be able to treat his patients. So I'm really excited to work with the Soma Appliance and bring it here to the U.S. I have a couple of interested patients who are not U.S. residents who are coming for the Soma as well in the next couple months. So I'm really excited about that, and we'll see where it goes. It's just an exciting time.
Oh, that's awesome. And it's so fun because you will actually be going and they're having the opposite weather here. So if you're experiencing like the crazy warmth that we are having right now, may you go enjoy their fall/winter, depending on when you're going. You said a month from now.
Yeah, it's gonna be the winter.
Okay.
Oh yes. I'm excited. I'm excited. I haven't gone during the winter before, so I'm excited.
Okay, well, so we have your intro that you are just way beyond dentistry, but let's kind of back up a little bit and tell me how you got first into dentistry and then how you got into pediatric dentistry.
Yeah, my dentistry intro story is so interesting. Like I just never wanted to be a dentist. Never went to the dentist growing up. My mom hates the dentist,
Oh gosh.
so we never talked about dentists. It's so funny how we never even talked about the dentist growing up. I wanted to be a nutrition consultant. I had this dream ever since I was a little kid of having a private practice where I worked with, before nutrigenomics was a thing, I
Mhm.
figured you would be able to like map the genome somehow and work with people's like diets. So I went to college specifically with the purpose of working as a nutritionist in a private practice setting and just like taking this field somewhere I'd never been before. And my sophomore year, a guy called me out the blue, a guy that I had met at a cookout function like I don't know, like 6 years before, randomly. It's a friend of my stepdad, but just was random. And he's like, "Yeah, so I'm calling you because I think you make a great dentist." And I'm like, "Oh, what?" First of all, who are you again? And secondly, why would I want to become a dentist? I don't want to clean teeth. That sounds terrible. And he's like, "Oh, we actually don't clean teeth. That's called a dental hygienist. And we do so many more things and da da da." And long story short, I just said to myself, okay, I have to go figure out what this crazy person wants because he's calling me, and my stepdad has vouched for him to call me and gave him my number. So I might as well go to his office. And when I did go to his office, what I noted was that there was so much love there. He's a big guy. He's 6'4", like 500 pounds, like big guy. And the kids just thought he was the biggest teddy bear. They love him so much. It never really was about the drill or the
Mhm.
fluoride or what. It was always about like, let me tell you about my soccer practice or let me tell you about dance club. And kids were so excited to come and share about their lives. And so that meant a lot to me because I love people and I love children and I coached basketball and I've always been intricately connected to youth on some level throughout my entire life. Even when I was a youth, I was in a leadership role with those young kids. So I just thought this has got to be like one of the greatest jobs ever. And so that was my introduction to dentistry. And it just so happens the guy that introduced me worked with kids. So I was able to see it from that level from the first time I ever saw a dentist do anything. It was with a child. And so I think that kind of guided
Mhm.
my compass in dental school to say, okay, I think pediatric dentistry is in my future.
Wow, that's amazing. So one part of pediatric dentistry that some of our listeners may not know about, because so often when we think about going to the dentist, we think about just regular cleanings, things like that. We don't think about the hospital portion of it. So one part that kept me from dual training in ortho and pedo was the hospital portion of that. So I would love just a little bit of insight of hospital dentistry. Do you still do some hospital dentistry? What were your feelings about that training? And how, like, what's the biggest recommendation that you would give to help families keep their kids from needing that hospital dentistry care?
Yeah, well, I have the pleasure of my introduction to dentistry was through low income dentistry, Medicaid dentistry. And I own and operate an office that is 95% Medicaid. So we see about 5,500 children a year. That's a
Wow.
lot of kids. So when people always ask me about my experience with kids, well, I'm now almost 10 years into working with an office that has over 5,000 kids in it. So
Wow.
excuse me, anytime you're dealing with a population that has a lack of knowledge about the importance of teeth, the
Mm-hmm.
importance of just overall health, it's never just a tooth issue, right? The kids will come in, sometimes their fingernails are really dirty.
Mm-hmm.
Their bottoms of excuse me, the bottoms of the soles of their feet are very black.
Mm-hmm.
Um, it's a whole health neglect issue. So most of my dental career is about empowering those kids, empowering those parents,
Mm-hmm.
knowing that just because we don't know things doesn't mean we can't learn things, and we can break things down into actionable steps that work for us and our family. We don't have to do what other families are doing. Excuse me, I have no idea why a frog jumped in my throat there, but
It came out of mine to yours.
that must have been sad. I wouldn't really accept it, but I'm gonna try to put it over there for a second. So excuse me, sorry about that. But it is about teaching, and most of the wellness is about teaching. So unfortunately, by the time I get to a lot of the kids, they have infection, active infection in their mouths. They've been in pain. They're missing school because of that pain. And so, if a kid comes to you and they have 20 teeth and 13 of those teeth have cavities, or 16 of those teeth have cavities, most parents are opting for doing that work at one time. That being said, I've worked with a lot of kids where we break those 13 or 16 or 20 teeth down into 6 visits, and they do amazing. But with gas the way it is, and with just the previous negative experiences with dentists in general, most parents don't want their kid coming back for fillings 6 or 7 times. So that's how the hospital dentistry happens. It's never for a kid that has one tooth and they're terrified of one tooth. That's my job. My job is to get them, not terrified of getting that one tooth fixed. It's for kids that have over typically 8 cavities in one little mouth. And so I've been doing that for years. I do that every week. I've completed about 750 cases of different children in the hospital, and we never had any issues. But that's because we choose healthy kids. We choose kids that have had, they've been cleared by their pediatricians, and the goal is always to never see that child again in that hospital setting. So I spend a lot of time, again, educating the parent about, hey, let's not beat yourself up for where we are. We're here. People always try to say you're a bad parent. We all fall down. It's important to get back up. So let's talk about how we don't end up here ever again. So yes, hospital dentistry is a big portion of my practice, because kids come in, unfortunately, with just terrible decay and very poor understanding of hygiene and its importance, and diet and nutrition and lifestyle and mouth breathing and a bunch of different things that kind of all flow together to make the perfect storm for caries. And so we fix it, but then more importantly, I think we gift the parent with the knowledge to be able to make that the last time they have to have that experience.
So it sounds like you have been able to take your love for nutrition and really make it even more powerful, because now you can reach the kids at a younger age and give it not just purpose for, oftentimes people will go to a nutritionist for certain needs, but not always for, total wellness, because they don't always connect the mouth with their overall health. And I love that you're really helping them connect that really what you're seeing in their mouth is a reflection of their entire body. Because if they're having all of that decay in their mouth, they're not healthy elsewhere, whether they're most likely underweight or overweight, not sleeping well, etc. So thank you for taking both of your passions and really helping to change our kiddos. And with that, can you tell us a little bit more about your 2 companies, the Bite the Bullet Wellness and the No Limit Baby? I think the rest of the time we're going to spend on this, because I was telling her before we started, I'm like, oh, I have so much to learn about what you're doing. Please share.
Well, I'm really excited about the work that I do now. It's great. So No Limit Baby. So goodness, I'm trying to think of when I was introduced to the Breathe Institute. It's been so long ago. Maybe that was 2018, like the spring of 2018.
I think you and I were one of the first people that we followed Dr. Zaghi. I think that was before he even got married. We were following him.
It was like before he was a rock star.
Yes.
Yeah, 100% for sure. And he's amazing. Lael, who runs the show really over there, she's amazing. She'll be at my wedding. She's awesome. And so I just developed this passion for the infants and the kid. Well, it started with the adults. It started with me. I'm tongue-tied. So knowing that and having that knowledge and understanding, most of my original education was looking to figure out and better understand the things that I was struggling with, which I think for a lot of healthcare providers, our personal journeys kind of guide our compass and what we choose to study, especially if we're continuing ed. But then once I got a passion from Dr. Pinto. Oh my goodness, Dr. Pinto. I have a love affair with Dr. Pinto. I love her.
Did you know she's
Her
also a
husband.
Hoosier?
I
I'm a
didn't know
Hoosier.
that.
Yeah.
I didn't know that. I'm gonna have to tell her. She didn't tell me that. I didn't know that. What I do know is that she has the best husband. Oh my goodness, he's
Uh,
adorable. And those two boys. She just has a great family and she's a great person. She deserves the world. I love Dr. Pinto. And so when I met her, I was like, okay, I think I'm obsessed with the babies now. Sorry, Dr. Zaghi, but I'm obsessed with these babies, and I'm obsessed with the way that she puts her thoughts together and her concern for the entire baby. So that guided my decision to open this company called No Limit Baby, because every baby deserves to breathe, sleep, and feed without limits. And it has evolved where now I do a lot of consulting consults. I actually don't actively practice that much anymore. I have my light scaffold. I'm ready to go if anybody brings me a baby, but um, it's more so I get phone calls weekly or emails or DMs on Instagram about mothers who need guidance,
mhm.
and I'm just, I don't know, gobsmacked that people think that I could guide them in a way that's authentic, because most of them go, hey, I need a real opinion. Like, I need you to give me
Mhm.
the real, like, what should I do next? Here's what I'm struggling with. Here's what I've done. Here's what I'm afraid to do. Here's what I'm afraid to say. So I just feel so blessed to be able to have a platform where people feel comfortable to do that. But that's kind of what we do at No Limit Baby. It was infant frenectomies. It now has sprouted into a bigger business where I talk to moms all over the country and
Awesome.
just kind of guide them and match them almost like a matchmaker with practitioners in their area that may work for them. So that has been really cool. And the reason that I kind of removed the clinical component and use more of my knowledge is because I've gone all in on Bite the Bullet Wellness. And Bite the Bullet Wellness is for those white knucklers, those tough cookies, those weekend warriors, those people who can't take their foot off of the pedal, like myself, who put their health care on the back burner, whether it be because they have children, because they have a career, or just because they just don't know any better to know that the number one asset you have is your health.
Mhm.
So I wanted to create a business that was for those individuals, like myself, who are just totally misguided on their nervous system, on breathing, and don't understand the brain breath body connection, and how it really is truly the foundation of doing any of the other things that people call me to do. Like adults will call me about frenectomies, but
Mhm.
they have no emotional regulation, no
Wow.
stress management, they don't sleep well. So it's about, like, where do you start? Where do you start? That was the number one question that I kept getting. Where do I start? How do I start? I'm so overwhelmed. There's so much to do. Where do I start? So I created Bite the Bullet Wellness for people who need to know where to start. And we start with the breath. We start with breathing. We start with figuring out who you are. I call it selfology, like really
I
getting to
love
know you.
that. Selfology.
Yeah, selfology, and mindset, and just really at the beginning. And then we maneuver into figuring out what's the number one trudging to the bathroom at 3 a.m. problem that we need to fix now. But really, it is about getting a good foundation and figuring out, who you really are, what really ticks the box for you. And I think getting that under control and a nice, easy little package helps people immediately, helps them with their
Mhm.
gut, helps them with their sleep, helps them with so many things before we've even intervened with an appliance or with a therapy of any level. So it's in its infancy, but I'm really excited about the direction that we're going. We're doing all our website and logos and all that stuff right now, so it's an exciting time.
Well, that's awesome because our mind is so much more powerful than what most of us give give it credit for, especially in health, where we learn about the placebo effect. And I don't know how it was at your dental school, but oh, that's just placebo effect. I'm like, but now I'm like, but that's the if you can get that without any of the side effects of the actual drug, then why don't we just keep gearing towards getting more of that placebo effect? And if we help train our minds that our bodies truly want to be healthy, that we can be healthy. I I help on the clinic floor at a dental hygiene school here, IU Northwest, and I remind these students because sometimes they're like, oh, they're really nervous because some of the lower incisors, especially, can be very periodontally involved and kind of be loose, especially once they take all the buildup off. I'm like, well, how about we shift and look at it as how much our body wants to keep those teeth. Our body wants to keep those teeth. It's doing everything possible to keep it. And so let's shift it from being like, oh my gosh, like those are terrible, we should probably get rid of them, blah, blah, blah. No, let's help our bodies keep them. They want them. Our bodies want to be healthy, but we don't talk about health. We talk about our symptoms and our sickness. So thank you for helping guide people, because that is one of the things with tongue ties now. In short 6 years, how much things have changed. The conversations have opened up, but still we're sometimes in that short, it used to be the Twitter feed, but now I call it like the TikTok 3-second hook. And it's like, oh, but that's just part of it. There's so much other stuff, so much to unpack, because especially if you've reached adulthood and then you want to fix all that, you've had all these compensations to work on. So thank you for really having a place for them to go. That's really important. And actually, speaking of places to go, since you are so focused on the baby, where should a mama start looking for support? If mama's just like, you know what, because I hear this, my baby doesn't have a tongue tie, but they're really colicky. But I just know because I've heard someone's looked at it, someone's confirmed, pediatrician, whatever, who it might be, my baby doesn't have a tongue tie, but they're really, really fussy. So where should that mama first take that baby?
Yeah, that's a great question. And this is based on, we may re-record this in a year and I change my opinion, but this is based on the fact that I follow Little Movers PT, Beth online. She's amazing, and other practitioners like that who don't have Instagram, who are based in physical therapy, craniosacral therapy, kind of a whole body kind of, but infant focused business, I think is the best place to start, because they have the eye to look at the whole body, and they have an interest to figure out, well, why is a baby colicky? And you can pay by session, which I think is great. So I'm thinking PT, cranial therapist.
Okay.
Because usually the mom would know, like that mom, if it was specifically feeding, the mom would say something specific to feeding, right? In which case I'm thinking, oh, lactation consultant or feeding therapist. But usually if the mom's like, something's off, it's in behavior, it's in just sleeping with her mouth open, you definitely want to go to someone who has a whole body understanding, can see tension other places in the body. Because if the tension is just here, that changes the treatment plan versus the tension is here, right? So I would definitely start there, because your average pediatric dentist is not going to know what to do with that little baby. And your average pediatrician, as you mentioned, is not going to know what to do with that baby. So you really have to start with the providers who have a specialty and knowledge and understanding, and they can be very hard to reach. They can be very difficult to drive to. They can be very difficult to afford. So I look at it as Disney. The same excitement we get about taking our kids to go see Mickey. Let's start saving and get that 6-hour drive to that practitioner out in wherever, X city, and bring that same energy and excitement about getting the right answers. Because it is like Disney. Finding the right provider is like a Disney experience. So a lot of parents will say, oh, I have this insurance, oh, I can't afford this, but they have iPhones and they have new cars and they have all of these other luxuries. And I say, well, we find a way to pay for the things that are important to us, for sure. So I would save up in finding that one practitioner who's the closest to you that has a specialty specifically in the thing that you're wondering about, because they're going to best be able to answer the questions. And that's like my best question. Like I'm imagining in my head, like, I'm having a love for authentic Italian bread, and I want to learn how to make it. I would like save, and I would like, well, first I would go online and like blast message a true Italian baker. Can I please learn how to do this from you? And one of those bakers has to say yes. And then I would start figuring out where I need to save to go to, Sicily or whatever I'm doing. And that's the direction that I would take with care. And my mom did that when I was a kid. We're talking 30 years ago. But if there was a thing or thing that needed to be known, she would save and we would drive and go wherever. It's about that sacrifice for your child. I think that parents can relate to that. So I think starting with figuring out which provider knows, what's up with the thing. Like you said, colicky. Okay, let's find providers that talk about content of colic. Is it really colic? Is it not colic? Study that content. Get in your PJs. Look at their website. Look at their social content. And if it resonates with you, if it speaks to you, then that's who you need to go to. Regardless of how far away they are, they will figure it out. And a lot of providers, if you have no money, a lot of providers do pro bono care, some kind of care, every quarter, every month, things like that. So that's my recommendation for the mamas who aren't sure where to start.
Well, and thank you for that reminder too, that the expectations of your providers really needs to be known, because like the training that you've gone through, the training I've gone through, it's different. Everyone's training is different, and you can't expect pediatricians to know things that really is not necessarily what they are there for. They are a primary care provider. And when we have questions about lactation, when we have questions about feeding, there are other providers that are in that specialty whose job that is. And I feel like sometimes it just gets to be something where we, just in general in society, get very overwhelmed, and we want to stick things on one person, whatever that might be. And when it comes to health, we want to stick it on that one person when that's just really that's not fair to that person, whoever that provider is, and to yourself, because everyone has different training, and their job is to then help connect you and refer you, know when to refer you. But their job isn't to have all the answers. No provider should have all the answers for you, because you're complex. we're amazing beings that are multifaceted and need a collaborative team. And so speaking of collaboration, I know that we're getting to a little bit near our end of time, but I would love if you would share just a little bit of your own health journey with us.
Yeah. I did want to say one thing about what you were saying, Doc, about not putting a lot of things on providers, if I can.
Oh, of course.
I always tell people, you got to understand that their doctors are people, right? Those are people. And as a boss of lots of people aren't always comfortable saying they don't know how to do something, even though the right thing to do is to say, I don't know how to do this. Often I have someone who works on my team that's like, I can do that, and they absolutely can't. So from the doctor's standpoint, as terrible as it is to say there's no tongue tie, there's no this, there's no that, it's so scary sometimes to say I don't know, because the judgment back from that patient may be, what do you mean you don't know? So then in order to prevent that, people just kind of I know everything, and it's just a defense mechanism. These are people. So like you said, allowing grace for the provider and knowing that they don't know everything, I think is really important. So thank you for saying that. My own health.
Well, and thank you for that reminder that yes, it is really hard, not just from the parents or who you're talking to, the patient, but also then in whatever realm you work in. Oh, well, they didn't have the answer. And it's not taught in dental school, at least I can speak for our dental school, my dental school, that it is not taught that you can be comfortable saying, I don't know. And hopefully that's changing, but that's not something I've run into any other provider saying that their school taught them to say, I don't know.
That's not changing. That's not changing, Dr. Murphy. And, it's funny because I was working with a company on the phone the other day, and they made an error. One of the companies we work with systems, our CRM, and listening to the person on the phone, they can't admit fault. Like that company can't say we didn't do this step. They kind of like, we kept saying, well, have you read the notes from the last time this happened? They couldn't say yes. They couldn't say no. They just would go to another topic. So we go, well, the last guy left really detailed notes. Did you read his notes? He said he left perfect notes. So if this ever happened to our system again, we could move past it. And they didn't answer yes, and they didn't answer no. So I think it's within this internal system we have to never admit fault. And it's funny because people don't sue nice people, they sue jerks. So actually you're better off just saying, I'm sorry, I don't know, if your biggest fear is like litigation. But anywho, I didn't want to go down the rabbit hole, but I did want to say that not everybody grew up with a mother like me who said, tell the truth at all times, be honest at all times. And there were like repercussions if you didn't. So I have no problem telling someone, I don't know, but I can find out who does. I will do some research and get back to you. I do appreciate now that not everybody grew up with a mother who demanded honesty at all times. And some people have performance measures and they're just really afraid to say, I don't know. So we really should go in with that knowledge that this is a human and, that they may not want to say they don't know. But to your question, back to my personal health journey. I've had a very interesting health journey that led me here. Right now, I've had ulcerative colitis. I received that diagnosis back when I was 17, when I was in college, and it's something that I've been battling for a couple years. I'm on steroids right now, so I've got my typical like steroid moon face going on. But typically, what I've learned about ulcerative colitis is that a lot of it can be managed through breathing and stress management, and so when my stress has been managed well and my sleep and breathing are adequate, I actually don't struggle at all with that condition, which is great. And so I work with some people behind the scenes to help them through that as well. But my health journey right now is in a place where I'm practicing what I preach. I wanna get better with going to bed at the same time and waking up at the same time. That's what I'm working on right now. But the history of my health journey led me here because I was having shoulder issues. And, I just chalked it up to playing sports for years, working out. At the time, I was working out 7 days a week. I said, I must need to stop working out so much. And I'm a dentist, and we have poor ergonomics. And like most of the dentists, I know shoulder issues. But when it started to become like unbearable, and I was now like, instead of working 6 days a week, I probably can work 4 days a week. Oh, this shoulder is getting tricky. One of my friends recommended that I see this specific PT who didn't take insurance, and I was complaining even though I had money. Like I grew up with no money and then had money and was like, I gotta pay for somebody off insurance. I don't want this guy. Like, what about all the people on my insurance? And she's like, no, I'm serious. You've seen 3 PTs in the last year, and while they're amazing people, you haven't been better. So let's be honest about that, because she was also my massage therapist too.
Those are great. They really know, don't they?
They know everything. They know your secret. Because you talk when you're on the table too. And she's like, look, you're not better than you were a year ago. You need to go to this guy. And I complain like, he doesn't take insurance. And that was the best thing I ever did, because in that first session, he started talking to me about teeth. Well, Jasmine, tell me about your teeth. And I'm like, I don't know what's wrong with you. And he's like, tell me about your sleep. Tell me about your breathing. Tell me about your stress. I'm like, what does this have to do with my shoulder? And he started talking to me about the connection between our teeth and tooth grinding and tooth clenching. And I didn't even realize at the time I was a clencher, right? Like it was the first level of awareness, and mouth breathing. And I'm like, what is mouth breathing? What is that? But I did understand posture. My mother complained about my posture my entire life. You'll never eat at the White House. You have terrible posture. Keep your food in your mouth. You can't ever find a husband like that. Those types of things growing up, right? And not knowing that I had a dysfunction, not knowing I couldn't have great posture because this is my body compensating. Of course she didn't know that, but I remembered posture. Okay, I could remember that. I could remember messy eating. So even though he was speaking a language I didn't know, there were pieces like, okay, wait a minute. Actually, I do know that my mom's complained about my posture, and I know that I'm a dentist, which makes me have, on top of already bad posture my entire life, now like historically terrible posture. And then he'd ask me about, can you dance? And I was like, interesting. I actually cannot. It's like my upper body and my lower body don't communicate. So upper body, dancing in a chair, I've got all the moves. If I move my lower body, I've got the moves. But standing up and trying to put the two together doesn't work well. I trip over my own feet. I played sports, but I was also extremely clumsy. He started talking to me about clumsiness and how that related to teeth. And your feet have an arch. Your diaphragm is an arch. Your maxilla is an arch. Those arches are connected. I was just like...
all in one session.
All in one session. All in one session.
And you're like, wait, I should have recorded this.
I have tried to get Michael Vita on a podcast episode or anything. I'm wearing him down over the years, and I've referred him My uncle is his patient. My best friend is his patient. Like, I've referred him so many patients over the years, and they all love him. But he really connects the whole body, and he was the first person to open those doors to my mind and helped my health journey in an incredible way. So even though I'm a little bit heavier than I was a few years ago, mainly because of the steroids and things now, I'm much healthier. I sleep better, even though my sleep is not perfect. He started me on this journey of wellness that is truly amazing and changed my career. You know, I told him I'm forever indebted to him for kind of stoking the fire of curiosity within my mind to say, what? I just graduated from dental school less than 5 years ago, and nobody talked about teeth being related to a diaphragm and a foot arch. What in the world? I need to know more, because that sounds super cool. So yeah, my personal journey kind of led me here, which is great. I'm excited that I could be the guinea pig to start this train that hasn't stopped at all in the last 5 years.
Well, it's all about mindset. And it seems like you started with that mindset, knowing that nutrition really was essential to good health and wanting to really pursue that. And then following the synchronicity of your stepfather's friend that wanted you to become a dentist. And now here you are. It just, the mindset, you had it, you just had to have all the things come together for that to actually then play out so that you can go ahead and change the pediatric field of dentistry. And I have to say, you said this, you are gorgeous and you are so thin. I don't know, you'd probably fly over here through the internet if you lost any more weight. And then I'd be like, great, come in and sit next to me right now. So I'm going to remind you, because accountability buddies have been what has really changed my profession trajectory, that I'm holding you accountable for looking at yourself in the mirror and realizing how incredible you are and being grateful for the steroids for helping you, but you look incredible. So there we go. And I will call out anyone that says stuff about themselves and remind them to look at themselves and talk to themselves like someone they truly love.
Yeah. It's definitely a difficult thing to do, depending on your upbringing and how you're raised, and then also, your own personal goals and how far away that space between where you are and where you want to be. It can be very difficult to be gentle to yourself during the time of growth. And I thank my fiance for being one of those people who's all about body positivity and, focusing on internal health and wellness versus outside appearance when you're in your, season of growth. So she's really good at reminding me, like, hey, I still love you. So so it's all good. But definitely speaking like you said, speaking like you're speaking to a best friend when you talk to yourself is one of the things that I have struggled with, still struggle with, and it's a journey in and of itself, and it plays right back into breathing and all the things that we've talked about today. So, which
this is actually the perfect transition to the Take 3 for me. So for those of you that are aware, Bree Grish and I co-created the Take 3 for me self-care movement. So in 3 minutes a day, you can really just reset and refocus your life. And we do a mini portion on the podcast. Dr. Elmore has agreed to do the mindset portion. So the 3 parts are a gentle movement, the mindset reset, and then breath work. So for our gentle movement, some of you might be driving. We've been sitting. So I just ask for you to kind of just wiggle, put your arms up if you can, whatever kind of movement you can do. If you can get up, even better. But just if you've been sitting, whatever, kind of just pay attention to where your body is. And we typically do different myofunctional therapy exercises that are face yoga exercises too. So that's the connection. That's the secret of how it got started, because I was watching all of these face yoga. Today was the fluffy head, but tomorrow is the gecko, which is what you were doing. Oh yeah, the fluffy head any of us can do. So really you just kind of take your fingers, make little circles, and then flick them off. And I like to say it's telling all that stress to flick off. So I'm not using a curse word. You just flick off that stress from your head. And I like to go right into the back of my neck right here and really do the circles. Yeah. And then just kind of, so that's why you can get the fluffy head, because if your hair is poofy and crazy like mine, you can kind of get some body into it.
This is awesome. I love it.
You got to join us. It's free. We do it Monday through Friday, and it's on Facebook. We also have TikTok. So join us. I'm going to hold you accountable, because then you can help lead the breath work too. So first we did the movement. Now we're going to do the mindset reset, where every day we challenge you to take a look at what you're grateful for, your intention for the day. And now lastly, it's one of the hardest for me, but has changed my life the most. What are you proud of yourself for? So Dr. Elmore said that she will share with us either all three or one of those mindset portions with us today. And I appreciate that.
Of course, I'm excited.
So which one would you like to share?
I'm going to let you pick, actually. This is your show. You surprise me. You pick one and I'll just go for it.
I'm going to have you say what you are most proud of yourself for today.
Okay. Today I am most proud of myself for keeping the promise that I made to myself. So one of the hardest things for me right now is putting myself last. So I put all the admin tasks, all the work tasks, everybody else before doing something simple. So I'm working on cleaning my bathroom. And I've been working with my breath coach on setting small goals.
Mm-hmm.
And I have a hard time even sticking to the small goals. But this morning, I was able to meet my daily requirement of putting the work in to clean up my bathroom. So I'm proud of myself for keeping the commitment I made to myself to get that done. So yay!
A good job, because it is all those small things really add up, and in your headspace, it means a lot. So I really do. I hope that you will join us, because marking down every day, we ask if you would really like it to write down, but saying that out loud to another person is also very helpful. We so much honor our loved ones, like you shared with us how much you love your fiance and what you're proud of her for. That we're very used to, but we're not very used to sharing what we are proud of, and understanding that you can be proud of something and that doesn't take away from what I am proud of myself for. And once we realize that all of us can be proud of ourselves and it doesn't take away from anybody else, that's when we can all rise up together and make the world just more joyful. So to round out our session, it's a little bit hard to do the breath work because then we go into silent airspace. So I do just ask to just right now for the listeners to pay attention to your breath. See if it's gotten short. Mine, when I get all excited, I go back to mouth breathing. I have to really concentrate while I'm talking. Yes. And really to honor our breath as being the connection between our mind and body. And our breath will tell us a lot. If we're very short with our breath, we're stressed. If we're nice and ease, then we are in more of that receiving mode of receiving all the greatness in life. So let's get that together, pay attention, and understand that ideally your breath is silent and your exhale is longer than your inhale, and it's in and out through your nose. Okay, so hopefully for those that are driving, you can spend the rest of your drive once this podcast is done paying attention to that. So Jasmine, is there anything else that you'd like to share with our audience today?
I think we covered a lot.
We
I'm
did.
just excited to be here. It's truly an honor. When you said, "Hey, do you want to be on the show?" I thought, "Oh my goodness, dear Mama, yes, I will do it. I love it." I just love what your book is about, and coming from the perspective of baby to mom. I think the theme of today has just been about grace, and you deserve joy, and life is never perfect. It will never be perfect. Just doing the best that we can. And giving it all we've got, and then some seasons giving it none of what we've got because it's a season of rest. I think just appreciating where we are in life and just going with the flow and spreading that love and joy, like you said, is key. So I just thank you for allowing me to be here today.
Well, thank you. And I'm going to share with you a reminder from Bree Grish. She is the acupuncturist and so Eastern Chinese medicine expert. She reminds me that winter is really the time of rest, and you'll be going to Australia when it's their winter. So may you have a little bit of rest during our summer, which is, our period of action, but few people get to actually enjoy both seasons in one time period. So may you enjoy that. And this quote, really, when I saw this, I just knew it was for you. Again, our quote today was, use your skills, your knowledge, your instincts to serve, to go change the world in the way that only you can. Again, that's by Robert F. Smith. And really, Dr. Elmore, thank you for following those instincts when you got that random call to call you into dentistry, for following that to then be, encompassing both of your passions to help these kiddos and to now be going beyond to get people on their journey. I appreciate your time. And I hope everyone just clicks that subscribe button so you can hear the next guest. And our next guest is Lael Johnson. She's a New York-based orofacial myofunctional therapist, dental hygienist, and founder of the Facial Connection. And we will talk even more about the Breathe Institute with her as well. Yes, thank you so much. And I'm excited to hear more as you continue with the branding for the Bite the Bullet, right? That's the one that's working on the rebranding, Bite the Bullet.
Yes, BTV Wellness. Yes. Awesome. Well, thank you. Thanks for having me.
Thank you. Until next time.